Good afternoon, ladies and gentlemen. This is your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. And today we have a very special program and also very special guest with us. And the program we are going to discuss today is the health challenges in Pakistan. And the guests we have, they are from an organization called Integral Global. And we'll see what innovative approaches Integral Global is taking to address the health challenges not only in Pakistan but also around the globe. So, in our studio at FM 87.6 in Islamabad, we have the guests with us, including Mr. Nabil Ahmed. He is the founder and director of Integral Global.
Nice
Thank
to
you for
meet you.
joining
Thank
us
you,
in the
Dr. Aftab.
studio. And also, we have Ms. Jenna. She is Senior Public Health Analyst in Integral Global. So, thank you for joining us in the studio. So, let's begin the discussion with Mr. Nabil Ahmed. So, this is the format of our program in which we normally ask our guests to give their educational journey, their career journey, and then we go to the main topic. So, let's start with Mr. Nabil Ahmed. So, Mr. Nabil, could you please share your journey, educational journey, and also your career?
Sure. Thank you for having us on the show. It's a real pleasure, Dr. Aftab, and congrats on a wonderful show. Thanks to the audience for entertaining us. My name is Nabil Ahmed. I'm the director and founder of Integral Global. With regards to my educational journey, if you can tell from my accent, was raised in the United States,
Right.
but I speak Urdu, and so
Nice.
I'm happy to be back in Pakistan. I went to school in the U.S. I went to school in California, and
Okay.
then my undergraduate experience or undergraduate education was at the University of California
Nice.
at Davis, and then I worked for a few years, and I went to the Johns Hopkins Bloomberg School of Public Health for my MPH. At which
Nice.
point I started working at the U.S. Centers for Disease Control, and then I started this company, Integral Global, in 2016.
Okay,
And so
nice.
we've been in existence since then.
Excellent. So let's talk to Ms. Jenna. So Jenna, could you please share your educational journey and career journey?
Yes, thank you. And echoing Nabil's sentiments, thanks so much for having us on the show. And it's a pleasure to be here and back in Pakistan again. So, as mentioned, my name is Jenna Buttolph. I'm a senior public health analyst at Integral Global. My educational background and career experience is a little bit different than Nabil's because I'm quite younger, but I'm starting off in my career doing amazing things, and I've had the opportunity to go to some wonderful places, including Pakistan. So my educational background, I went to undergraduate at Miami University in Oxford, Ohio.
Okay.
My major was public health promotion, and I minored in French nutrition and global health.
Excellent.
There, I had the opportunity to really experience global health as a global immersion participant in the Gambia. I did some routine immunization work there. It really got me thinking that I wanted to continue in the global health space. So from there, I went to Emory University to pursue my Master's of Public Health, graduated with a global health degree concentrating in infectious diseases, and I've been with Integral Global for the past 5 years.
Okay, excellent. So we have like journey of both guests with us, and that's really excellent with a lot of expertise in the area of public health. And that's actually we are going to discuss the challenges in the world and also specifically about Pakistan. So in this discussion, I would like to continue with Mr. Nabil Ahmed, and we wanted to learn more. Like, what was the need of starting this Integral Global? While there are so many organizations working in the public health, so what is like special about this organization?
Well, that's a great question. My career started working with the government. I started with a local health department
Okay.
in California, in San Mateo County. It's on the west coast of the United States. I was then able to work with the state of California on reproductive health issues, and then I went overseas. Actually, I was a Fulbright scholar in Bangladesh, and
Okay.
I was there working on a research study in rural Bangladesh, and then I joined the CDC, and at the CDC I had the fortune of having a long career, or a reasonably long career, in global health, and so
Okay.
I was able to work in multiple countries on a multitude of different programs. But I realized that there was a gap in implementation for the U.S. government, and particularly for a lot of government U.S. government agencies, at least, it's very hard for them to work in developing countries, particularly
Right.
in very resource limited and conflict and post conflict countries. And so originally, I started Integral Global to try and be an interlocutor for the federal government to work in countries like Pakistan, Bangladesh, in Central Asia. We work in Uzbekistan. We've worked in the Middle East in multiple countries such as Iraq and Kurdistan. And anyways, we work in about 19 countries. And that sort of blossomed into us being implementers for U.S. government clients such as the U.S. CDC, the Department
Right.
of State, and others in about 19 countries. And so Integral Global, it's different in the sense that we focus a lot on definitely ethics. So we keep our cost prices down, for example, and we don't try and overcharge the client. We also work with complete sustainability in mind. So,
Right.
as an example, working in Pakistan, we try not to do parallel programs and try and do programs that build into a more sustainable public health programs that last beyond our presence in the country. And so, and then we've kept our companies small. We haven't expanded all over the place. We've maintained a culture of doing cost efficient but effective programming in the countries that we work in. And that's what's frankly allows us to survive as this landscape of public health has changed over the last 6, 7, 8 months. And so Integral Global to me is special because we're not sort of the traditional implementer, but we're a company that works on a very grassroots level and sort of grows public health programs organically and then tries to hand off the program as much as possible to the host government.
Okay, excellent. So, being a public health expert and analyst, so what is your own perspective after the corona epidemic? So, how the public health is changed afterwards?
Yeah, so the corona epidemic in general for me was a very interesting time because I was finishing my undergraduate career at the time. So it was very different in terms of, I think a lot of people that are probably listening to this have had a different experience thinking that they had to stop going to work and they would have
Right.
to start this remote position. And here I am thinking about how am I going to get into this public health career. One, it's a timely experience to go in, but two, it's also scary because I'm not sure what exactly the landscape's going to look like. So I think that it's changed in terms of people start to really think about what global health security means from a pandemic prevention perspective. But additionally, I think it really has put a lot of connection and collaboration in a time of dire need, way more than I think a lot of people have originally anticipated it to be. And what I mean by that is I think that for a long time people assumed that you had to be in person, which don't get me wrong, I really value in-person collaboration. I don't think anything will ever be able to replace it, but I think that being able to promote different health outcomes from a remote way was very different, and now you see people doing it all the time and they're able to connect with different countries, different cultures, different regions in a much more sustainable and effective way rather than waiting and being able to determine how best to move. So in that aspect, I think that COVID has really changed the way that from an HR and work perspective, it's completely changed the landscape and also has really just brought to light the importance of pandemic prevention.
Right. So, just a quick question from you as well. So, what was your own motivation of going into the public health?
Yeah, so I originally started off as a nutrition dietetics major because I was a D1 athlete in college and I thought that I wanted to maintain going into athletics and go that route. And then the more that I realized that it was very patient centric, which I think is excellent, I started to realize that I was more population centric, and that's really what motivated me was how can we reach the greatest impact from a population perspective. And I commend all of the people that go to medical school. I work with some great physicians. I just feel like from that aspect, I really wanted to try and reach the most vulnerable, which is one of the great things that I love working at Integral Global is just you're able to really do that and accomplish it. And then to see the impact is just remarkable. So I transitioned from the dietetics major into public health, and then I took a few global health classes, and then I realized this is exactly what I wanted to do. But of course, as anybody that's going into their career, they want to make sure that it's actually the right fit. So the experience that I had in West Africa was exactly what I needed, and it made me realize that this is the right major for me, and was a perfect jump to go straight from undergrad to graduate at Emory.
Okay, excellent. So, Mr. Nabil, you was talking about the journey of Integral, why you have started that organization and the impact you are creating. So far, like, what kind of projects right now you are doing, not only in Pakistan but also around the globe?
Sure. We started Integral Global particularly around the global health security agenda. And the global health security agenda encompasses four broad category areas, which is surveillance of diseases, development of a workforce, capacity building for laboratories around the world, and then lastly, developing functional emergency operations centers, which allowed for rapid responses to disease outbreaks. And that was sort of the first projects we got. It was started off very small. We got projects looking at, for example, multi-drug candidates here in Pakistan. We had projects working on COVID-19, in 2020, but it's blossomed since then. We've actually done quite a bit more. We've done work around One Health and zoonotic diseases, surveillance for zoonotic diseases. We've done work around water, sanitation, hygiene. For example, we work in Pakistan in the slums to do water, sanitation, hygiene. We have a very strong program in hepatitis as well. Pakistan has one of the largest hepatitis burdens in the world, hepatitis C burdens in the world. And so we've been fortunate enough to embark on hepatitis C work here in Pakistan with the Pakistan National Ministry of Health Services. In addition, Jenna has actually expanded the portfolio on chemical, bio, radio, nuclear capacity building work in a lot of countries that we work in. So Integral Global started off very small. We had, 2 or 3 projects, and just like any business or organization, you do good work and people come to you for more. And so we've been able to develop an organization that now is working in multiple countries. We also have a strong team. I mean, that's helped a lot. So we've had a team of staff that are dedicated and will write proposals. And so I think all that to say is that we're continuing to grow. We're not stopping our growth. We've grew in global health security. We grew in chem, bio, radio, nuclear. We may grow more in chronic diseases, for example. That's another
a big area.
Exactly. That's a very big area.
So another thing is like you have just mentioned that you started with few projects and then it went very successful, and also you had like. Right now, I don't know how big is the team, but your team is expanding, I'm sure. So, like, you started in 2016, right?
Yeah.
Your organization, and in 2025, you have expanded to 19 countries. So, what do you think? What is the success story? Like, how you could expand to? Because it's a lot of challenges are there, especially in the developing world. They don't accept the things, especially. Like they are coming from the other organization, being an organization working in so many. So how you actually tailor the thing? Because I know so many other organizations, just like Health Security Partner is there, CRDF Global is there, that they are the US organization working in different countries, but they also face a lot of challenges being implementing the thing, and you have successfully implemented so many projects. So what do you think? What is the secret recipe of your success, like working in so many countries and doing a lot of projects?
Yeah. I think unlike some of these other organizations, such as the one you mentioned, we've also remained very nimble and flexible. We don't prescribe to, one way of doing things. So earlier you asked me, what's the key to, how do we work? And I mentioned sustainability. So we work very closely with the ministry. So anytime we work in a country, we attempt to work as closely with the government counterpart. In Pakistan, we work hand in glove with the ministry here, and our country lead, Dr. Hassan Mahmood, sits with the ministry and has close contact. So whenever we work with a project in the country, we always make sure we're working with the in-country partner. That's number one. Number two, I think that we have a lot of ethics and integrity. So we're not compromising quality over quantity. So we're not compromising cost over delivery of service. And I think the key to success is also, I think, as in life, you have to have a good network. You know,
Right.
I was lucky enough to leave the CDC with a strong network, and to this day, it serves me well. And you know, I thank the CDC and also my government colleagues
Right.
all over the world, foreign government colleagues. And so, when someone wants to come and work with Integral Global, for example, you know, in a country like DRC, we have the ability to rapidly deploy assets onto the ground,
Right.
meet with ministry counterparts, meet with other government officials. And I should say, Integral Global is very good with working with other NGOs or governmental partners. So,
Right.
you know, we don't have an ego about working with other folks. So it's easy for us to deploy staff and work with people in country to achieve the outcome of the project. So, and then, you know, I think we have dedicated staff. I mean, like Hassan has been with us since the beginning, and he's a wonderful staff member. Jenna's been with us for a while, and others. We have about 10 people at the headquarters level, and then we have about probably over 150 staff around the world, and so that's been a big success. And then whenever we have staff, we actually empower them to not just be pigeonholed into the project that they're doing, but also explore other opportunities. So someone who's working on WASH in one country may say, you know, there's also an opportunity to work on measles in that country, and
Right.
we will explore that and listen to the conversation of the person in the country.
Excellent. So this is really excellent. Like, I think this is the secret recipe working with the government, because the first challenge is actually in most of the developing world, because we also work with different government organization, is to convince the ministries. So I think you have like successfully done it, and if there is a government support, definitely you can easily carry
Yeah.
on your work. So coming to Jenna, so Jenna, you worked in Africa as well. So what do you think, what are like the major health challenges in some of the African countries and also in this part of the world?
It's a good question. I think that one of the things, at least from an outsider perspective, and particularly just thinking of some of the implementers from the West, is that you can't necessarily just assume that all of the health challenges in one continent are going to remain the same in all
Right.
of the different areas. I mean, the challenges that West Africa experiences is very different than what East Africa and South Africa have. So I think that, and it's not just from a regional perspective, I should add that it's also country level as well.
Right.
So just to make an assumption and say, oh, all of West Africa has one specific health challenge would not be the right approach. There's different countries that all have different challenges. Actually, Nabil and I were just at the International AIDS Conference last month in Kigali, Rwanda, and to see the challenges just from there, from changes in PEPFAR and other funding levels, it's very different from seeing what's happening in Uganda and Rwanda to South Africa to a country like Burkina Faso that heavily relied on donor sourcing, and being able to provide some of those funds totally changes the landscape. So I think that just having the understanding that you can't necessarily, and I think a lot of people have this thought that, oh, if there's one large issue, which historically used to be HIV/AIDS in Africa, that's the hot topic, but all of the countries have different they have different challenges, and they have different experiences. And when I think about West Africa, my heart immediately goes to malaria, because that was one of the key issues when I was there. Routine immunization was a large challenge, just because there wasn't enough HR, and they were having nurses being able to provide vaccinations, but there still wasn't enough at the time. So in a country like Gambia, it was a huge challenge, just because there wasn't enough people there to provide the support. So that's one major thing. And then coming to Pakistan, I could actually say a very similar thing, which is that it's a country, but there's so many different provinces that all have their different challenges.
Right.
So it's one thing to keep in mind, is that a challenge that maybe in Islamabad is very different than what's happening in Punjab or Sindh. So just keeping all of those local perspectives in mind. And something that Nabil brought up is that we have really great, excellent talent here on the ground that understand the local challenges. And one of the
Right.
things that Integral Global and in Pakistan specifically pride ourselves in is that we're located throughout the entire country. It's
Okay,
not just
excellent.
we have folks in Islamabad that are saying, oh, there's a challenge in KP, this is what we're going to do. But in fact, we have local staff in KP that are telling us, this is the challenge, this is how we need to come up with a solid solution to make sure that we're addressing those challenges. And kudos to the entire IG Pakistan team and all of the consultants that we have, because we would not be able to have the success that we've had. So I think just keeping in mind the difference between a regional, country, and a local level, and seeing those challenges and being able to address them from a very grassroots level is the only way to, one, have sustainability, but two, actually reach the people that need the help and support.
Definitely. So this is very important, that involving the local people, because they have they know the problem, and they have the understanding of the problem, and if they can communicate well, definitely more solution could be brought in. So working in, just like you have mentioned, that in African countries the challenges are different from country to country. Even within the country the challenges are different. So one of the challenge in most of Africa, I've been to different African countries and I have seen that one of the challenge is the HR, because they don't have the trained human resource. That's very important. So how your organization is actually working for this specific area of training the people, especially HR capacity building?
So we've done various projects, for speaking in Africa, we've done various projects in training and capacity building initiatives, from being able to provide nutrition support to the most local level in Burkina Faso, to doing surveillance and epidemiological support in various countries in East Africa, and even something as simple as compliance support, which sounds so broad, and it's, I'm here just to provide some training on some of the government needs on HR, but that's such a need. So we're providing not only training from just a technical capacity, but also from an administrative and operational logistic support capacity. And I think one of the key things that we've done and prided ourselves in is we make sure that we hire as local as possible. So it's not just someone that's coming in from the US, for example, that's saying, I'm going to conduct this training in, let's say, Tanzania. I'm going to go to Dar es Salaam and support training, but rather it's the people that have the knowledge and context. So we've been able to really identify those people that have been great champions for their country, and then foster their growth and make sure that they're continuing to disseminate their knowledge and training down. Instead of, I know a huge problem just globally is that the HR turnover is a huge issue. You have someone that's staying in a position for 5-10 years, they decide to go do something else, perhaps they leave the country, they go find a different opportunity. Who's to replace that job? And then if they don't have the right training in place, there's a huge gap. So we've really tried to make sure that not only the training that we're doing is sustainable, but there's also methods to receive that training. It's not just a position dependent person, but rather we've tried to have remote trainings and online tools that we've been able to provide. So in the event that there is a turnover in some of the needs for HR, they still have that training able to be provided to them.
Excellent. So this is really good initiatives, and we should focus, just like you have mentioned, the methodologies that we have to train the people, and we have to build the capacity. That's very important. Absolutely. To sustain the things. So coming to Nabil, actually you just mentioned that you are also have worked in CDC. That's a very important organization. It's working all over the world, and they have a very strong network across the globe, especially huge presence in US and everything. So what CDC helped you to the training that you had there, and bringing that training back to Integral Global? So how much that was helpful for you? And right now, do you have some collaboration with CDC, or you are working independently?
Well, we're an independent organization, but we do have a strong collaboration with CDC. And I think, CDC is my home. It's where I got a lot of my training. Not just at CDC, I actually worked a lot for about 7 years at the state of California. I know I was able to work at a very local level. I worked with farm workers on the coast of California that came and had, I did a lot of contact tracing and sexually transmitted infection contact tracing.
Right.
And then working at a state level prepared me to work at the CDC. And the CDC, what it did is gave me the preparation to work more at a global level. Between my master's program at Hopkins, my Fulbright scholarship, and then the CDC, it allowed me to learn how to work with ministries, work on diplomacy and health diplomacy.
Right.
And it taught me how to also anticipate the challenges. And I think that if you look at the public health landscape, as I said earlier, over the last few months, it's changed a lot, and it's very fragile. It's very, very
That's
fragile.
True.
And
all the funding cuts, so I don't know how much your organization is affected by that.
Yeah, we were impacted a little bit. Thankfully, we diversified our funding. We are not just dependent on federal government, U.S. federal government funding. We have funding from multiple sources, and so that's helped us a lot. But I think I think the benefit of working at the CDC really was exposure to the very, very smart people that work there and very qualified people, but also to very, very smart colleagues around the world who
Right.
run ministries. And so, yeah, that was a good. That was a good
So
move.
actually, just like you have mentioned, the recent funding cuts, that's
Sure.
affecting. So coming like to Pakistan,
Yeah.
before like we start the discussion, what are the public health challenges in Pakistan and how we can address those? I think it's very important to know the global scenario because of because US was the major funding source for the projects all over the world, like USAID programs, and there were so many other components of those programs. They were running all over the world, and I have seen all those organizations which were very much dependent on the US funding. So they are now they face a lot of challenges. Some of organizations are even disappeared because
Yeah.
of that lack of funding.
Yeah.
So what do you think, like your organization? I think the role of your organization is even more important in the present time because there are so many organizations which actually wiped out
Yeah.
after cut
Yeah.
this
Right.
funding. So how you can play in the present scenario, what important role you and your organization and innovative approaches that you can take? Because I personally feel that now your organization have even more important role. So what do you think now on the global scale? What role you can play
Yeah.
and how you can even do more projects across the world?
I think these are the ebbs and flows of development funding. Things are great one year, then the administration changes. Things are bad another year, and I think it's just like the economy. It goes up, it goes down, and you have to sort of ride with the tide. And it is what it is. And no matter where your politics lie or whatever your leanings are, I think this happens in any business, really. Sometimes you can't always be in an upward trend. Sometimes your business goes down, sometimes it goes up. And so this is just one of those things that's happening in public health. I think for us, the yes, I think that our organization being private is going to have a big role to play. It's also important to diversify your funding. If you're
Right.
reliant on one source of funding forever, it's going to impact you. It's like if you sell one product at all times and that product is no longer popular and you're not selling other products, that's going to be a problem. Integral
Right.
Global actually did a nice job of diversifying about 2.5 years ago, and that's probably helped us a lot. We also looked at high need. We looked at high need. We're not just working in public health, as I mentioned earlier. We're working in chem bio radionuclear. That's an important topic nowadays. We're working with pharmaceutical companies, which are although they're under scrutiny, you can't do without drugs. And so
Right.
I think that having that diversification not just allows us to exist, but it also gives us a breadth of expertise that can be leveraged for organizations such as in Pakistan, and that's
Right.
helped us a lot.
Excellent. So, actually, now we move on to Pakistan. So
Sure.
the things, because we have to focus, our main topic was also the addressing the public health issues in Pakistan. So Pakistan, the story is very different, as you know, and as you have just mentioned, both of you, that the challenges here are actually enormous, especially in the public health and also overall in the health sector. If we talk about the global ranking of health infrastructure in Pakistan, it's not really very good because we stand around at 150th position in the world among 200 countries. So the situation is not that really good. And Pakistan is an important country because we are a huge population of around 250 million people. But if we talk about so many diseases, for example, if we talk about hepatitis C, Pakistan is number one in the world. If we talk about diabetes, we have the highest prevalence in the world. In hypertension, we are at number 2 or number 3 in the world. And if we talk about the mortality of the newborns, we are also at 1 or second or third position in the world. So we have one of the highest mortality of the mothers as well as the newborns. So these are the real health challenges in our country. So being the organization that is working across the globe and also especially in Pakistan. So knowing these challenges, how you people are solving these issues. If we start with one of the programs that you have started, the WASH program. So can you please a bit highlight that program and how it's helping the community? If anybody
Well,
from you
yeah, I mean, I think
would
WASH
like to
is a
comment.
broad program. I mean, WASH is the basic concept of WASH, which stands for water, sanitation, hygiene, is that you teach people particularly at a young age, school-age children, to wash their hands and use hand sanitizer, which can abate 80% of diseases.
Right.
And if you look at a country like Pakistan and other countries that we work in, it mostly impacts the poor, the underprivileged,
Right.
the population, disadvantaged populations, also known as marginalized populations. And so if you teach them basic concept like wash, it can abate a lot of diseases that are transmitted but through, hand
Right.
touching the mouth. And so, I should also caveat this with saying we're a small organization, so we can't work on everything. And I
Right.
think there's lots of room to play. There's other organizations, of course, doing stuff on hypertension and all the other issues you mentioned. So we take on topics that we know we can have a valuable impact on. So as with hepatitis, for example, and I'll use that, we knew that we had a good foothold within the ministry. I should thank Dr. Huma Qureshi and Dr. Hassan Mahmood, who are hepatitis experts, who really helped focus our efforts in the marginalized slums of Islamabad.
Right.
And as a pilot and as an example of success, we're able to replicate those programs in other slums in urban areas throughout Pakistan. So that's been our measurable impact. And now
Right.
that project, for example, has been taken on by the ministry as an example of a strong output that can be incorporated into the national strategy and into the technical advisory group. And I should say, in Pakistan, despite the statistics you mentioned, which are very accurate, there's a huge amount of capacity in the country. I mean, there's this very I'm amazed by some of the very, very intelligent doctors and the very intelligent technical staff, epidemiologists that exist here that actually do wonderful work on a daily basis. We encounter them, and I always tell people, when I go to other countries, that look at Pakistan and how they've mobilized their staff. So for all the the unfortunate indicators, there's also a lot of good that comes out of the country, and Pakistan exports a huge number of doctors, for example, to the United States.
That's
there's
true.
A lot of
Even
strong
more
doctors.
neurologists, they are working in US
Exactly.
and in Pakistan.
That's right. That's exactly right. And so we try and leverage that expertise as much as we can.
Excellent. So there is another scenario I think that's very much relevant to you, and that's like the stunted growth in Pakistan. So like your one of the minor subject was the diet, and also you are a public health expert. So the scenario is in Pakistan, unfortunately, on one side we have like around 40% of the kids, they have the stunted growth, and on the other side we have a epidemic of obesity among the children. So how we can balance these two things, and being like your expertise, what do you think, what measures and what policy we should adopt to actually address this challenge in our country?
It's an interesting question because they are complete opposite ends of the spectrum, right? One of the things that I was working on in undergrad was actually differentiating the understanding of kwashiorkor and marasmus, which are the two stunting diseases that are seen in children and throughout the world. And I think that understanding the difference in training at what Nabil was saying at such a young age, that's one of the great successes with WASH, is that if you're able to go into schools and really help them understand the importance of proper hand washing, you can take that lesson and do the same thing for nutrition. I mean, it's obviously, that's a more loaded question in my opinion, because I don't think that everybody in the country, particularly when we're talking about vulnerable and marginalized communities, have access to specific nutrient dense foods.
Right.
So from a policy perspective, I don't think I'm the right person to answer that question, I'll be honest with you, because I think that there needs to be more people at the table to have a policy discussion. Everything is a multi-sectoral relationship and coordination, particularly in countries such as Pakistan, in order to ensure that there is that sustainable success that we're looking for. So I think from a technical aspect, the more education that we can promote, that's again from a very sustainable level, such as understanding nutrition, dietitian, being able to discuss nutrient-dense foods, particularly for young mothers. I know that that's a very large discussion to be had. I think that we could do more than just having a open-based discussion on here's a food group, here are things, but actually what are ways that we can help them get those nutrient-dense foods.
Right.
I think that that's a challenge of its own, but I think that if we bring people to the table to have some of those more difficult discussions on a policy perspective, what we're able to actually accomplish, we'll be able to help increase some of the success here. And one of the things that's not just about nutrition, but it's probably about everything, is that you can never have a siloed project. You can
Right.
never have anything be siloed. So you've probably had a lot of different international NGOs, local NGOs, private companies, and institutions all talk about nutrition. But if they're not able to actually collaborate together and talk about some of the successes that they've had, their own challenges, we'll be in a never-ending cycle, because you'll never have the right information to be shared within each other, and then you'll be proposing very similar projects that never actually reach the grassroots
Right.
level.
Excellent. So, coming to Nabil, with the rich experience that you have, like working in California, as you have mentioned, working in CDC, and then leading the Integral Global. So, the challenge in Pakistan and also in most of the developing world, and also somewhat in the developed world, what they have experienced so far is the awareness. So, how we can actually, what is your own perspective that how we can raise a massive awareness in any country, and like you can also share the like some of the examples from the developed world, and specifically tell us like in Pakistan, this is a huge challenge. And even like if often you have seen like our health minister, he's also talking that we have to raise the awareness, we have to reduce the number of like people going to the hospital. So if they will be well aware, they will take all the measures, and then this is how we can reduce the like patients in the hospital setting. So what do you think? Like this is a real challenge. We people are working in this area since long, but still a big challenge for us. So what is
Yeah.
like your insight, and what practical steps we can take so we can convince the people that they have to also like they have to take care, just like the wash program. If they can wash the hands, we can like reduce so many diseases.
I think awareness is a multifaceted approach. It doesn't just start with one organization. I mean, I think you have to start at a young age. You have to use multiple community partners. So
Right.
you use schools, you use universities, mosques, in marginalized communities like the slums, the churches, and it's a multifaceted approach. And
Right.
awareness also means having good pre-information. So you have to have data. You can't have awareness without understanding what your baseline is. So if you're making someone aware about WASH, well, is there actually a problem with WASH? And if it is, then you have to understand. And that's something we did with our WASH programs. We established a baseline before we did our awareness campaigns. So you have to understand the gaps
Right.
that exist. You can't go into a community and say, well, you need to wash your hands, because the first question to say is why, and
Right.
so awareness goes hand in hand with having a good baseline, which is through sound data collection and through sound. You have to do your homework, essentially. And then you have to involve multiple members of the community. I think that, if you involve the institutions that I mentioned, that's going to be a big piece of it. And then when you're doing the awareness, you have to make sure your message goes out widely, and it has to be tailored to your audience.
Yeah.
If you make your someone we were talking about to this morning says, if you publish, for example, your awareness messages in an English newspaper in Pakistan, well, the poor person, in the slum is not going to speak English or read,
Right.
read in English, so they have to have it in a format that they understand. So we've tailored our messages, for example, through WhatsApp messages, blast text messages, through visuals that allow people to understand and absorb the information quickly. So awareness, I think, has multiple layers where you have to involve the community, you have to have good preemptive information, and you have to disseminate the message that goes along with awareness that is relatable to the audience. And then there has to be follow-up. You were talking about policy. There has to be follow-up, not just from the organization or the government doing it. There has to be follow-up from the government side. There has to be follow-up from the community side, from the international partner side. And then you evaluate. And then when you go to a public health school, they teach you the cycle of health promotion, health education, and that starts with collection of information. Then starts with tailoring of information and dissemination, evaluation. And it's a very popular model. But yeah, so awareness is multifaceted.
Okay, excellent. So I think this is very important, and as you have mentioned, that we have to involve the multi-stakeholders, and then
Right.
we have to like engage them in a way that we could get actually some output from that. Coming to Jenna, there is a lot of discussion, especially started in US, and I also was one of I joined one of the program in US about One Health. So can you please elaborate this? What is the concept of One Health to our audience, and also how One Health approach can be very beneficial in country like Pakistan?
Yeah, I wish I had my colleague Farouk Tahir here because he's our One Health expert. But yeah, so One Health is the linkage between human, animal, and environment. Just the most simplest way to describe that. And I think that for a long time there was a intersection between human and environment and human and animal.
Right.
But the accomplishing the entire triangle is a not relatively new, but it's a newer concept to the general public. I think a lot of people in public health have had some understanding that you have to establish that strong linkage, but from the general public, I think it is a newer concept that there is a reasoning for all of these things to be intersected and have that relationship. So I think for Pakistan specifically, and I'll actually reference one of the projects that I didn't have the opportunity or pleasure to speak on. I'll have Nabil actually jump in a second. But one of the first projects that Integral Global did in Pakistan was a One Health project, and it was discussing, I think it was CCHF or brucellosis, was one of the first things that we did.
Yes.
And I think that, instead of me talking about the project, because you were here, you may want to mention
I
what
was
exactly
working
we
with
did.
an organization that did Crimean Congo hemorrhagic fever during Eid,
Right.
when they have the sacrifice of the animals. It can spread to farmers and cause long-term disability and hemorrhagic fever.
Right.
And the importance there was building awareness with the farmers.
Right.
And you can't, obviously during Eid you have Bakr Eid, you have the sacrifice of the goats and the cows.
Right.
And so you're not going to stop that practice, but you can build awareness around that. And as going back to what I was saying, you have to build the educational tools. You have to talk to the farmer, make sure that their economy is not compromised because of the CCHF virus, and teach them ways to limit transmission while still practicing their traditions. And so One Health focuses on that. One Health focuses on, as Jenna mentioned, human health, animal health, the environment, and how you can abate diseases while looking holistically at the ecosystem of disease transmission. And while it focuses mostly on zoonotic diseases, I think it's a concept that can be applied to a lot of different diseases to improve health outcomes.
Well, because we are running short of time, so I
Sure.
will have a quick conversation about, just like you have mentioned about the awareness, that we have to involve the multi-stakeholders in that. So quickly we would like to learn, as I mentioned, some of the statistics in Pakistan, the challenges in the health and especially the public health issues. So what do you think, what measures that we take, because you have done several projects in Pakistan and they were quite successful as you have run those projects, especially you have done on One Health about the WASH program. You are quite active in the hepatitis program, and I have seen the activities of Dr. Hassan. He is working enormously on those programs. So what do you think, knowing the challenges in Pakistan and working in different countries, so quickly if you would like to mention that these are the immediate steps that we should take in Pakistan to address these challenges?
Ooh, I think interesting. I think bringing stakeholders to, we're part of what's called the TAG, the Technical Advisory Group. And so that brings stakeholders to the table and allows them to discuss interventions, policy, and, future action plans. And so making those effective is a good thing. Bringing a TAG together, technical advisory group together, and making those effective, run by government officials is important. I think that happens, and there's a lot of, obviously a lot of talk and a lot of policy that comes out of it, but following through and then making sure the policy is implemented at a ground level is important. I think that hearing each province's, Jenna mentioned earlier that we have different provinces here in Pakistan. Listening to each province's needs and tailoring them to each province is very important. And I think developing pilot programs, that are tailored to the audience that we're trying to reach, collecting that data and information, and then creating larger scale programs that are good for that audience is important. And then of course involvement of government partners. I think that government is trying. It's there's a lot of need and not a lot of money, and so government is trying to do the best that it can.
Right.
and it's trying to listen to all the people, but it's hard. It's hard, and so you have to build systems. And I hope and wish that Pakistan builds those systems in the future where they are able to get input from the ground, develop proper program and policy, and then deliver it back to the people. And that's tough for any country. Frankly, in the U.S. we have the same issue. There's a huge homeless population, and it's hard to service all of those people. And so it's always an issue. There's more need than there is resources. And so how do you mobilize resources? So that's hopefully better coordination among multi-stakeholders that is government led.
Yes, so you're right. Actually, some of the challenges in Pakistan, they are still there, but some of the things are even best in Pakistan. Just like you have mentioned that we have a good human resource in our country, we have a good infrastructure, and people are willing to do the things. So that's are really good things in Pakistan. Because we are running short of time, you have just mentioned quickly, if you would like to highlight about the non-communicable disease. So this is one of your future projects. So how you are looking at, because the world is changing now, and we are very much from infectious diseases to non-communicable disease.
Yeah.
So
we just got some funding to start work on tobacco cessation. So we're looking at tobacco cessation work. We have some funding from a group called Vital Strategies in the U.S., and we're working with the tuberculosis program here to incorporate tobacco cessation. And as we know, tobacco is a huge contributor to a variety of diseases that I don't need to mention here. And so we're embarking on looking at how tobacco cessation can improve chronic disease outcomes. And I don't want to take up too much of your time, but yeah, that's one of the projects we're working
at the end, we just wanted to have like a short message from both of you. So what our audience, and they are very much looking to your conversation, and that's very important, especially because Pakistan is facing a lot of health issues, and you have addressed very clearly what are like challenges, how we can raise awareness, and how we can do better in this area. So at the end, what message you would like to give to our audience?
I think one of the biggest things, which I commend you for, Dr. Aftab, is working with young scientists. I mean, I think we need more scholars, scientists. We need good folks out in focusing on the sciences. Right now, I feel like public health is under attack, and so we need good scientists, good people who go off, and it's not just about going to a good university and getting a PhD and all that stuff. I think that what's important is that you have good Pakistani young people who contribute back to science and stay in Pakistan, not just come to the U.S. and become a doctor, but stay in Pakistan to contribute to the society here and contribute to the positive health outcomes that you're looking for. And
excellent message.
Yeah, my message would be for young people to focus on the sciences, the STEM, science, technology, environment, and math.
So the message is very important. We have to focus on STEM, and the other important thing is you have to stay in Pakistan. So Jenna, so what you would like to say to our audience?
I'm going to echo Nabil in terms of that. I do agree that public health is under attack, and I think that particularly from us coming from the U.S., we've seen a lot of changes, particularly in the global health space. So I think that just working with government, establishing trust, being able to collaborate with them and really understand their needs is going to be a huge change. It's such a needed change. I think that for a long time there were so many, I want to check this box off because it contributes to the funder, and this is how we're going to continue working in this area. But you'll see time and time again when you have meetings with people, they feel that you're checking off the boxes for the funder, but you're not checking the boxes for the actual local people or for the government of Pakistan in general. So being able to actually collaborate and communicate with them and make sure that you're adhering to what exactly they want to accomplish for their people and the population is going to be such a timely thing in these changes, but such a needed strategy moving forward.
Okay, excellent message. So because we were running short of time, we had to cover many other important things, but inshallah ta'ala we'll continue our discussion if we get the chance in the future. So with this, we are very much thankful to Mr. Nabil Ahmed, the founder and director of Integral Global, and Ms. Jenna, the senior public health analyst. Both our guests are from US. They joined us in the studio of FMAT San Francisco today, and we are very much thankful to both of them for joining us and having a very good conversation on the health issues of Pakistan. I'm sure that addressing these challenges with the expert opinion of both of our guests would make a real difference in Pakistan. So with this, we are thank you to all our audience for joining us in this conversation. So we'll continue these kind of discussion in the future as well. Thank you.
Dr.
Thank you.
Thank you very much.